All right, let's jump right into this explainer. We're going to equip you with the ultimate sports performance playbook for handling those unexpected hurdles in your OSD rehab. If you're a high school athlete, you know there's this powerful, totally natural force that can just suddenly shift the ground right beneath your feet. And yep, that's a growth spurt. Today, we're breaking down exactly why these spikes happen, what they actually mean for your training, and how you can stay firmly in control of your athletic destiny. Man, it's just the most frustrating feeling in the world, isn't it? You've been doing your wall sits, you cleared your plyometrics, you're finally feeling fast and explosive on the field again. And then, boom, out of nowhere, you wake up and that familiar sharp ache right below your kneecap is back. I want to hit this head on right out of the gate. If you're suddenly dealing with a return of knee pain after making really solid progress, your frustration is completely valid. But most importantly, I am here to assure you right now, your rehab did not fail. Seriously, you didn't do anything wrong. You really need to understand that a recurrence of symptoms during a growth spurt is honestly to be expected. It's just part of the journey. When that pain flares up, the absolute worst things you can do are panic, give up, or lose sight of the incredible physical capacity you've already built. This isn't a failure of your body, and it's not a failure of your physical therapy program. It is simply a normal, entirely predictable biological event. Your body is just doing exactly what it's supposed to do, which is growing. We just need to manage the temporary side effects of that growth. Section 1. Inside the capacity gap. Let's look at the biology. To truly master your rehab, we kind of need to look under the skin. See, when you hit a growth spurt, your tibia, your shin bone, rapidly gets longer. In fact, during peak velocity, a bone can literally grow up to a millimeter a day. That's wild. The growth plate at your proximal tibia is furiously adding new bone. But here's the catch. The collagen remodeling in your patellar tendon and the apophyseal ossification happening where that tendon attaches, they simply cannot keep up with that rocket-fast growth. The bones grow incredibly fast, but soft tissue adaptation, that's slow like a turtle. And that mismatch creates what we call the capacity gap. Think of your patellar tendon exactly like a really thick rubber band. One end is anchored to your kneecap, and the other end is anchored to your tibial tubercle, which is that little bump on your shin. Suddenly, your shin bone grows longer. Well, that new geometry automatically pulls the rubber band tight. It creates this intense tension and a mismatch in your knee, even if you haven't added a single minute of new training volume to your schedule. The bone length just changed way faster than the soft tissue could adapt, creating a temporary gap in your knee's capacity to absorb load. Section 2. Spotting the spike. Time to track those metrics. To stay ahead of this capacity gap, you need a solid radar system. A height gain of 2 centimeters or more in a single 4-week period, that's a massive biological event. This is the absolutely critical short-term metric you've got to track diligently at home with a wall-mounted measure or in the clinic, because crossing this specific threshold signals that a major growth velocity spike is actively happening, and your soft tissues are about to be put under immense structural tension. We also need to watch the slightly longer trend. If you hit either this long-term mark of 4 centimeters in 3 months, or that short-term mark we just talked about, it proactively triggers a change in your game plan. Specifically, hitting these numbers triggers an automatic 25% reduction in your sport volume. And we do this before your symptoms even have a chance to return. By doing this, we're giving your tendons the breathing room they desperately need to adapt to your new bone length. A lot of times, this allows you to just sail through a massive growth spurt entirely symptom-free. Section 3, modifying your game plan. Here's how to respond if those symptoms do come back. But what happens if you actually do flare up and your morning pain at the tubercle climbs back to a 3 out of 10 or higher for a few days? Okay, here is your progressive step-by-step game plan that dictates exactly what you should do today to safely manage it. Step 1, drop 1 tier. If you were doing heavy sprinting, just drop back to plyometrics. Step 2, bring back your phase 2 and 3 isometrics. Step 3, reduce your overall sport volume, so practices and games, by 25 to 50%. And step 4, reassess in 2 to 4 weeks. We're simply going to dose down briefly, let the biology settle, and prepare to ramp back up. Now, this specific exercise is basically your anchor during a storm. 5 sets of 45-second wall sets at a 60-degree angle performed daily. Returning to this specific isometric maintenance dose provides the exact analgesic relief, which basically means pain relief, and the foundational loading your knee really needs. This is the precise formula to settle a flare-up within 4 to 6 weeks. It communicates safety to your nervous system while physically beefing up the tendon's capacity. Let's take a second to clear the air on some things that mentally trap a lot of athletes. It's absolutely vital we debunk these common misconceptions right now. So, people think that if pain returns, the treatment failed and they have to go all the way back to phase 1 of rehab. That is totally false. What's actually true is that your body is just facing a brand new biological demand. Your built-up capacity did not evaporate. We simply drop a tier, manage the load for a few weeks, and you re-enter the protocol exactly where you left off. You do not lose your progress, I promise. So here's your daily practical playbook. Track your height every month. Do not panic when pain flares. Map your expected peak growth windows against your heavy competitive sports calendar. But I really want to highlight a crucial safety note here. Don't hide your pain. Trying to hide it just so you don't lose game time is exactly what you must avoid. Pushing through a mechanical capacity gap literally destroys soft tissue. Underreporting your symptoms to your coach or your parents is exactly how a short, highly manageable 4-week recurrence spirals into a massive, season-ending 8-week setback. Please be honest about your pain so we can keep you on the field long-term. Section 4. Reaching the finish line. Let's talk about apophyseal closure. As we kind of zoom out to the big picture here, remember that you shouldn't navigate a major recurrence alone. Proactively reach out to your physical therapist or your sports medicine doctor to ask these specific questions, especially if your peak growth window overlaps with your competitive season. Ask them, hey, how do we handle a mid-season dose down? What's my current risk of stage? Do we need repeat imaging, or is this just standard growth? And how do I actually tell the difference between a normal OSD flare-up and a brand new injury? Getting these answers gives you ultimate confidence. And this brings us to the real light at the end of the tunnel. Your ultimate take-home message today is that OSD actually has a hard biological expiration date. It's called apophyseal closure. This typically happens at RISR stage 4 to 5, which is around ages 14 to 16 for girls and 16 to 18 for boys. Once that cartilaginous apophysis fully ossifies and structurally fuses solid with your tibia, the structural mismatch that drove all your symptoms ends forever. The gap closes, and the disease state is just over. You understand the biology now, and you know exactly how to spot the signs before a spike takes you out of the game. But here is the ultimate question. If you learn to master your load management right now, while you're battling a capacity gap, just imagine the explosive, totally unhindered power your knees will be capable of once that growth plate finally fuses solid. Take control of your data, do not hide your pain, and I'll see you on the field.